It is my great pleasure to welcome today to our Kurierem Medycznym Mr. Justin Gendy, who is Managing Director of MSD here in Poland. And we will be talking about healthcare situation, pharmaceuticals in Poland and in Europe. And my first question to you, Justin, is what does innovation mean to you and your company?
Well, thank you first for having this conversation today. It's really an interesting topic on the table. And really when we look at innovation, you can look at it from multiple planes. First of all, innovation for us is anything that relates to getting access to patients with medication faster. And you can look at it from a multiple perspective. If you look at in the past, multiple diseases you didn't even know how to treat. People were dying of diseases that we didn't even know existed at that time. And if you look at how innovation has stepped in terms of manufacture, in terms of clinical trials, in terms of getting access to molecules, that's really where we focus. And all you needed to see is in the pandemic, when there were no options, is that all pharma companies had to look at what do they have and how quickly can we have access to either vaccines or treatments. So for us, that's really where innovation plays, is to ensure that patients now and into the future have access to better medication.
Thank you. To follow on your question and narrow it, to zoom in on Poland, you arrived into Poland quite recently, but I think you now have a good view what's going on. And in your opinion, what are the biggest health challenges in Poland?
Yeah, another great question. Yes, I've been here just on 6 months now, so it's been an incredible experience to understand and see what happens in Poland. And what we see is two sort of distinct diseases. I mean, we have cardiovascular disease, which is #1 at the moment, one of the biggest issues, and then we're looking at oncology, which is really where sort of where we focused on, and how does oncology work in the future. And if you look specifically in Poland on the oncology side, where we specialize, is there that you have almost 1.2 million people living with any type of cancer in Poland, with 170,000 new diagnoses every year, of which 100,000 patients are dying. And if you just look at that ratio, that really sort of has a huge impact on the people and the economy in Poland.
I have a question to you. Where are we in Poland in terms of implementation of national cancer strategy? How do you see it? What is the situation in cancer care? Because you talked about cancer, and how are Polish people doing in terms of health? Is it important to increase patient awareness and take care about themselves in treatment and prevention?
Yeah, so I think those are really 3 or 4 questions that we could really elaborate on and go in depth. Is that #1, where do we stand? So there is the whole national plan for oncology treatment, and it really looks at where diagnosis happens and how do we treat, how do we get access. And if you look at, it's a plan that's spanning 2020 to 2030. If you look at how the government has invested there, I mean, for this year alone, it's 450 million Polish zloty, and basically a commitment of $500 million Polish zloty for every year thereafter. And if you see that it's almost 3/4 of these plans have already come forward, and more than 50% of these specific regimens and have been tabled and taken to both the health technology assessment and as well as seeing how they're going to implement it. So a lot of work has been done there. But then you touched on the topic about health, and that's something where we really need the focus on education for patients, education for physicians, on what is coming and how do we look at this and down the pipeline, and how do we get access to new medications, to new vaccines, and really expand that to make sure that oncology doesn't play the major part that it plays now in Poland, and is more comparable to the rest of Europe and the rest of the world.
I would like to use the example of lung cancer. Thanks to reimbursement, recently has changed a lot the landscape of patient access to modern therapies. But at the same time, according to the Economist report, only 50% of patients actually use available drug programs. Why is it so? How does MSD help solve these problems? What role do you see for MSD in this respect?
Yeah. I really think when you talk about 50% of patients, I mean, that really is a scary figure. I mean, if you just think of lung cancer being one of the most devastating, one of the biggest diseases in a country like this, to only have 50%. If you look at what should we be aiming for is probably around the 75% mark. That's really when you're having the impact. And if you look at the reason behind that is that on one hand you have drug programs, but the drug parents sometimes have this knack to really narrow down what is actually what has been put forward. So therefore patients that typically would have got in other countries are now being narrowed based on certain factors, which in essence means is that a patient has to be a lot sicker to get treatment, which is really counterintuitive if you think of treating in oncology, is that we really are moving into a new world where we're not talking about overall survival and the survival of a patient. We're really talking about how do we cure patients, how do we get a patient after cancer to come back into society and to be cured and not have all these other diseases. So us as MSD are really focused on that in terms of how do we find these patients, and that's the other element where the problem lies, is that we see a problem in the patient flow within the system. How long does it take from a patient to be diagnosed to actually get treatment? And that is, as you know with your background as a physician, is that cancer is not something you can wait. The longer you wait, the more the disease progresses and the sicker the patient gets and the less chance you get. So we really need to change the focus of really treating patients earlier, getting them earlier onto treatment, and that time to take there really needs to come down.
Mm-hmm. Let me go back now more to the European and country landscape as well. There is a lot of discussion about the new regulation concerning pharmaceutical law in European Union. And how do you see this as a representative of innovative industry? MSD is one of the leading companies. Do you see it as an opportunity or a threat for the industry, for your company, for patients?
Yeah, any reform of these type of legislations, we see as an opportunity. As long as we are able to have a dialogue with those that are making these rules and regulations to make sure that we give our insights and input. So anything that leads to increase in patient access, faster access, equitable access in countries and across countries, we're really in favor of that. And if we look at how we compare to some of the US and China markets, there Europe is really lagging behind. And we need to start getting the right incentives to make sure that Europe is able to significantly progress. So some of these elements, when it comes to intellectual property, will actually stifle that. To say, if you're reducing their time from 8 to 6 years is really a concern. So these are elements that we need to work on and work on together. And I believe that this is an old legislation that really needs to be reworked. If we all do it together, we can actually make a huge impact, not just for Poland, but the rest of Europe too.
We talked about treatment. The sooner you start, the better. This is obvious, but before treatment, you have prevention. And isn't it better to prevent than treat? And I know you produce, you introduced, you vaccinate people, girls and boys with HPV. Are you involved in it heavily? How do you see it? Because it's a bit, for the company, it's a bit contradictory. Once you prevent, you don't you don't have treatment, which is obviously for patients absolutely fantastic.
Yeah, I think, in the paradigm of cancer and patients, you have to work on all elements of the sphere. From prevention to treatment, you need to be, because there will be patients that already require the treatment. But as you stated earlier, the best measure is prevention. On an economy, it's probably the cheapest way to do it is to get there early, because as you know, with treatment can be long and the consequences on people are far greater. And I think that's when really Poland moved into a new era when they started the HPV program, the national program. And what is incredibly exciting there for us is that, you know, initially it was supposed to start for only adolescent girls in 21 and boys in 26. But this is now kicked off with gender neutral for 2 age cohorts, both 12 and 13, you know, in June of this year. And if you look at that, you know, already we have almost 100,000 young people that have now been able to get a vaccine that they wouldn't have before. And if you look at in the future what this can, you know, prevent is incredible. Now that being said, it's 100,000, so it's kicked off. So we, you know, looking at about a 12% coverage rate, what we call the vaccine coverage rate, and the aim is to get to 60%. And obviously, getting to 60% is, you know, quite a big task. So that's why we need people to be educated about this. You need people to understand, you know, what really helps when it comes to prevention versus cure, and getting the information to parents, to everyone, to understand that this is the way you secure your, you know, your children's future by doing this. So that's on the one hand. And then, you know, if you're looking at the total Beating Cancer plan, you need to get to 90%. Now that's no small feat, and we know that takes years. But the only way we do that is with education and by partnering both public and private to make sure that the education information is out there.
Well, I think it's fantastic. And do you foresee, everything goes well, let's say, that you can eradicate cervical cancer if you really start these vaccinations early, as you said, both genders? How do you see it?
Yeah, I think the cause of any vaccination at the end of the day is eradication, is to really eliminate diseases. And we've seen certain cases where, you know, this is the main focus. For example, in Australia, where this is happening. So this is the end goal. But like I said, you need to get to that high vaccination rate to really give yourself the sort of the best opportunity at this.
Justin, if you could elaborate more on obstacles, challenges in implementation of you know, HPV vaccine here in Poland, what is a barrier, or what are the barriers? Because, you know, we want to get it as quickly as possible.
No, so if you look at, you know, currently how it's rolled out, you know, it's going well. I think there's expectation, but what do you compare this type of program to? Because it's not a school-based program, so therefore it's a, you know, GP-based program, and therefore you actually need, you know, your healthcare practitioners and your patients and your parents to actually be aware and actually ask for this and go out and look for it. So I know there has been some communication from the Department of Education stating their support of it, but really we need everybody to be active, to understand, and to understand what this actually does from a vaccine perspective and into the future. So therefore education, looking at how we can get more healthcare practitioners involved, how we can get more vaccination sites involved, how we can really spread the word to make sure that people understand and are educated about this type of vaccine and what it prevents into the future.
It is said that spending on healthcare should be seen as investment in health rather than cost borne by the state and the citizens. Do you agree with this approach?
Absolutely. I don't think I could agree more with the statement in terms of this is an investment, especially if you look at the population demographics of today. You have an aging population, you have a population that is far more disease burdened, and with a population that's not growing, you need to have a healthy population. And we know that, you know, if you again use the pandemic as an example, that prior to the pandemic there was a high proportion of you know, people in Poland that were in good health. Now we see more than 50%, I think it's 52% of patients actually have chronic illness. So if you're looking at that, that's how do you invest in your people to prevent that and also to treat that, to make sure that your workforce is able to, you know, basically to work and to add value to your country and your company. So that is really a huge focus.
When it comes to the country economic development, we know about invention of breakthrough drugs, vaccines, MSD is involved in, but there is also an economic impact of being in the country, you know, working with the healthcare professionals, working with the local businesses. So can you elaborate on that? How MSD is supporting local economy?
Yeah, so I mean, there's sort of multiple facets, but I mean, we can highlight specifically when we look at clinical trials, for example, you know, in the economy, is that for us as a company, this is the third biggest clinical trial site in the company in Europe and the sixth biggest globally. We currently have some of our global visitors here to come see the sites and understand why it's going so well here. But really there we have almost 150 clinical trials running in 500 sites with more than 3,500 patients on active trials. So you take that into consideration, the magnitude, and then we also have a data management center here. So in total we employ around 600 people that in effect creates 11,000 jobs. And the size of this data management center is the second largest for us globally out of 6. So that's also very significant what we are stimulating in terms of the government, the economy, employing. And then on top of that we have manufacturing sites. So obviously we also contribute towards the taxes. And if you look at just in the period of 2008 to 2022, just from an R&D perspective, we invested over 1 billion zloty. So that just shows, we really are committed to investing here.
If you would monetize everything, I mean just a rough figure, how would you see the impact of MSD on the local economy? Because you said 1 billion zlotys, it's just an investment, but it's not just an investment, right? I mean, you have to multiply it most probably.
Yeah, no, I mean, that is just in R&D. I mean, if you look at the total investment over the same period, it's about 2.7 billion zloty. So therefore, that's a huge investment, whether it's in taxes, in investing in education of physicians, in clinical trials. So yeah, it really is a huge scope of what we're doing here.
And my last question to you, what role can MSD play together with the pharmaceutical industry in implementing the European cancer plan, which is kind of a master plan for Europe? Huh?
Yeah. And so with us and other companies, and like you alluded to in a question earlier in terms of, one part we can do is really working with public-private partnerships, and there we have worked with and currently working with the National Cancer Institute and also with the Warsaw Innovation Hub. So these are areas that we could use more and explore more as companies and as MSD specifically to roll out the plans that are coming. So when it comes to the whole European pharmaceutical strategy and with the beating cancer plans, these are areas where we need to really focus to get the data in, work together, see how we can collaborate further and really expand this across. So I see some clear tasks that we can work together there.
Justin, thank you very much on behalf of Kurierem Medycznym, myself, but also mainly patients and healthcare professionals. Thank you, and we wish you and MSD here in Poland a lot of successes.
Thank you very much for your time and for the opportunity to have this discussion with you today.
Thank you.